and it's giving lots of folks the power to innovate in new ways. And one of the themes of exponential medicine is to see how patients are included and how they're playing a role in creating new solutions, even for themselves. And really pleased to have an example of a patient innovator, the CEO of Sana Health. Is going to share a little bit of his journey and what he's been doing to use some of these technologies to answer a core unmet need for many patients around the world. Richard, come on in.
Thank you very much. Good afternoon, everyone. So this is me near Sana'a in Yemen in 1992. A few hours after that photo was taken, I was forced to drive that Jeep off a bridge in order to avoid a head-on collision with a petrol truck. That resulted in spinal injuries from THC10 and a nerve damage pain problem that was so severe I was given a 5-year life expectancy. I was medevaced back to the UK, and standard of care 27 years ago when this happened hasn't changed. It starts with opioids, goes on to gabapentin and other drugs, then it looks at implantables, TENS devices, and when all of that fails, they end up saying, do some meditation, or mindfulness-based stress reduction, as it would now be called in the clinical setting. And then when everything else fails, they basically say, look, sorry, you're on your own. And in my case, that was, you've got 5 years to live, and it's going to be extreme pain until you die. Sorry. So what's the problem with some of those approaches? Well, the opioids, all of you here are aware of the problem, 72,000 deaths last year. Opioids are a great tool and toolkit for acute pain. For chronic pain, they just don't work very well, and they have very, very severe long-term side effects. So what are some of the other approaches that are being tried that are beginning to actually help people? Well, all of them revolve around electronic medicine, around treating the brain as an electronic system where you can input data in certain ways and get a result. So up here you have TMS, a transcranial magnetic stimulation in the top left, then implantable devices, the external devices, and then there's a VR device. Now, all of these are looking at how can you change states of consciousness, how can you change electrical patterns in the body, and they're beginning to show promise. But let's go back to my position, lying in hospital, and my journey. So the biggest problem within chronic pain is it's a complex number of issues that are rolled in together. So issues around anxiety, sleep problems, depression problems, all of these things play into chronic pain, and they are why the drug approach to this issue is not very effective. So going back to in hospital, when I was trying meditation, I thought, well, I can see how this would work if I'd had 20 years of meditating before I actually had my accident. But in the position of actually being in pain already before you try and learn how to meditate, it makes it really hard, if not impossible. So I got to thinking, what if I could actually get my brain to do what a 20-year meditator's brain does? And luckily for me, there was already 50 years of Western research into how meditation changes the brain by that stage. And particularly a guy called Maxwell Cade, who did a lot of these two-channel EEGs, looking at what does the frequency distribution pattern look like for a brain that has done 20 years worth of meditating. And you can see on the graph, you get a large amount of alpha activity, a large amount of theta activity, and that's the difference between long-term meditators and not. So I set about to try and find a way to create that meditation state from the outside in, and this is what I came up with. A way of using pulsed light through the retina, through closed eyes, sound through the ears, and using a heart rate variability sensor to create a feedback loop and collect data. So what can you do with light and sound that you can't do with any of the other approaches? Well, it turns out that a big problem within chronic pain is having disparity between the left and right hemispheres in the brain, and that creates an increased sensitivity to any pain that you have. My brain looked like the one on the left. This was actually a veteran with TBI and chronic pain, but mine looked very similar, as does everyone with chronic pain. And after 4 hours of using the device, you can recreate that balance between the two sides of the brain and decrease sensitivity to pain. This was another one. This was actually a sniper who was experiencing what they call brain fog from repeated small concussions. And again, the same thing, using a device, you're able to get that back to normal. So there's a reason why when we come to gatherings like this, things like meditation and yoga are offered. And with a device, we're trying to create a way of actually creating that experience from the outside in, so that if you're beyond where you can be helped by yoga and meditation, we can actually help. So here was one of our first patients to use one of the first prototypes. Hattie had chronic regional pain syndrome, and her arms were so sensitive to the touch that she hadn't been able to go to school for 3 years. And within 3 weeks of using the device, we actually managed to get her back to school, and we cut her opioid use by half. And 4 years later, she's still using the device every day. So since then, we've done a bunch of clinical trials. The first one was with help from Stanford and Special Operations Command. We looked at device versus sham and increasing levels of relaxation, reducing pain, and improving heart rate variability. Then we went on to look at opioid use disorder. And then finally, most recently, we've done fibromyalgia, a fibromyalgia study. Now, fibromyalgia affects 10 million Americans, 80% of them women, and they have no solutions other than a cocktail of drugs that at minimum effect, basically just helping manage symptoms. And 60% of people with fibromyalgia choose not to take that cocktail of drugs because they believe the side effects outweigh the benefits. This is a summary of this fibromyalgia study. So in our very last study, which happened last weekend, we looked at fatigue mitigation. We got improvements in reaction times. And we managed to mitigate fatigue 3 times more than sham with this device. So looking back over the history of this, we've had a very large amount of help from a lot of people along the way. Starting with one of our earliest commercial clients, which is actually Richard Branson, when he was trying to go around the world in a balloon. He used our device to put himself to sleep on the balloon. And then more recently, that's Bertrand Piccard in the middle picture. And he used the device to put himself to sleep while he was going around the world on the solar impulse plane. And then more recently, we've just had help from NATO, where they gave us the Innovation Challenge win this last week. So I just want you to think about, if you can do such large effects by just using pulse, light, and sound, what else might be actually possible? So the device saved my life completely because it removed all of my nerve damage pain, and I haven't had a minute's nerve damage pain since 1993. It's already helped hundreds of people like Hattie. And if you'd like to help us, help get it out to millions of people, then please come find us in the Innovation Lab at the back of the room, and we can give you a demo of what's possible. And at the very least, you can take a nap with the device in the middle of the conference. So thank you all.
No napping allowed. Any lessons for other patients, anybody who finds literally a pain point that they want to solve, right? We all experience those in our lives, and part of the challenge and opportunity is to solve for them. Any kind of lessons you'd have for other entrepreneurs?
I think the key lessons are actually around, once you've found something that works, the really important thing for getting it from something that's worked for you to getting it out to the broader community is, the biggest mistake I made was thinking that credibility was a bar. And credibility is not a bar, it's a ladder. And getting those first data points in the crappiest, cheapest, quickest way that you can, and getting a little bit better, a little bit better, a little bit better, that's really quick path to actually getting to really high quality data. If you try and jump from the bottom to the top, you can't get physicians to pay attention, you can't get the money to get the trials done. You have to get the best data you can, the quickest you can. So in my mind, the idea is the minimal viable data is actually the way to go. That's the lesson I would...
MVD, awesome.
Which I knew.
Great, thank you, Richard.
Thank you, everyone.